Now the classification of uveitis. We finished the anatomy, and then we will discuss with you the classification of uveitis. We will show multiple classifications of uveitis. Number one, depending upon the site of inflammation. We can classify this into anterior uveitis, intermediate uveitis, posterior uveitis, and panuveitis. Anterior uveitis, it is iritis, cyclitis, iridocyclitis, according to the involved part. As iris and ciliary body are continuous, iritis seldom occurs without some inflammation of the ciliary body and vice versa. The posterior uveitis, it is inflammation of the choroid and the surrounding structures. Surrounding structures, it means the retina, the retinal vessels, the optic disc. So posterior uveitis, it is choroid inflammation and surrounding structures. The intermediate uveitis, it is inflammation of the posterior part of the ciliary body, which is the pars plana, and the anterior part of the retina and the choroid, and the anterior part of the vitreous, which is called the vitreous base. But the panuveitis, it is inflammation of all parts of the uveal tract, the iris, ciliary body, and the choroid. The second classification of uveitis, it may be classified into acute inflammation, subacute inflammation, and chronic inflammation. Acute inflammation, in which the inflammation subsides within the first 8 weeks. But in chronic type, the inflammation continues more than 3 months. Another classification of uveitis is according to the pathology. It is divided into granulomatous and non-granulomatous type. The granulomatous part, it is insidious in onset, and the eye relatively becomes white. It's a chronic. We can see medium and large KBs, which is called creatic precipitates. It may reach to mutton fat KBs, slightly aqueous flare, nodules on the iris present, like Kopp's nodule are seen on the pupillary margin, and Posaka's nodule are seen near the collarette. The another type, it is a non-granulomatous type. It is acute onset of severe inflammation. The eye becomes very inflamed, the red eye. The course short, and the KBs may be small KBs, small creatic precipitates. There is intense aqueous flare, and there is no nodules present on the iris. Another classification, another comparison between granulomatous and non-granulomatous pathological types of uveitis. In granulomatous type, dense, broad-based posterior synechiae tend to affect entire uvea, heavy vitreous exudation, the etiology, direct organismal infection, and it is more common with complications. But in non-granulomatous type, fine synechiae tend to affect the anterior uvea, fine punctate opacities in the vitreous. The etiology may be allergy, and complications is few. Another classification of uveitis, which due to the cause of uveitis, it is etiological classification. In most cases, it remains obscure. The cause, remains obscure in almost cases of uveitis. The etiology, it may be infection. This infection may be exogenous. The organism reaches eye from the outside after perforating injury or perforating corneal ulcer or intraocular operation. This usually leads to suppurative iridocyclitis, endophthalmitis, and even panophthalmitis. Uh, the infection may be secondary due to spread from other ocular tissue like corneal ulcer or scleritis. May also the infection may be from endogenous source. Organisms primarily lodged in some other organ of the body reach the eye through the bloodstream. The infection may be viral, may be bacterial, may be fungal, may be protozoal, may be nematodes. So the viruses like herpes simplex, herpes zoster, measles, mumps, rubella. Bacterial infection like tuberculosis, syphilis, leprosy, gonorrhea, brucellosis. Or fungal infection, histoplasmosis, aspergillosis, candida albicans, actinomycosis. The protozoal infection like toxoplasmosis, nematodes like ankylostomas and filariasis. The etiology of the uveitis also there is allergy other than the infection. Allergy through to presence of previous presence of bacteria like tuberculosis, usually in the lung and the lymph nodes, streptococci like in teeth, tonsils, sinusitis, sinuses, urogenital tract. Primary source of infection exists at these sites. At one time, the infection was generalized by the escape of organisms in the bloodstream when the ocular tissue uvea has become sensitized to them. At a late date, further dissemination of the organisms or their proteins meeting the sensitized uveal tissue excites an allergic response. The allergy may be due to lens proteins, like in phacoanaphylactic reaction. They have also a toxic action on iris. Uveal pigmentation in sympathetic ophthalmitis. This is allergy, type 4 hypersensitivity reaction to part from the uveal pigment from any trauma or any surgical interference in one eye produce sympathetic ophthalmitis in the other eye. Another causes of uveitis may be constitutional disorders like diabetes mellitus, gout, rheumatoid arthritis, so either in adult or juvenile type, and ankylosing spondylitis. Also, another causes of uveitis include the trauma, either blunt trauma or, as we said from the allergic part, the sympathetic ophthalmitis. The cause, it may be idiopathic, like sarcoidosis. It is a granulomatous inflammation of the uveal tract. Vogt-Koinagi-Harada disease. It is a two diseases. The Vogt-Koinagi, it is part of anterior uveitis accompanied with skin manifestation. And the Harada disease, it is another disease affecting the posterior part of the uveal tract with neurological manifestation. Number 3, it is a Behçet disease. Behçet disease, it is about it is a triad of syndrome, which is called Behçet disease. It is uveitis with genital ulcers and oral ulcers. Also, the cause may be miscellaneous, like intraocular hemorrhage, intraocular throat tumor, which is called masquerade syndrome. The causes of uveitis may be idiopathic, may be specific or non-specific. Suppurative inflammation, exudative inflammation, and granulomatous inflammation. Suppurative, exudative, granulomatous, according to the infiltrating cells. Either it is a neutrophils, so this is suppurative inflammation. If we add mast cells and the plasma cells, it is an exudative inflammation. But if the large cells like macrophages and the giant cells, multinucleated giant cells, it is a granulomatous inflammation.